Welcome to our video. This is a journal club video about an article with the topic of public knowledge and attitudes toward liver diseases and liver cancer in the Brazilian population, a cross-sectional study. This is an article that published on the Lancet Regional Health, Americas, Volume 23 on July 2023. Before we jump into our main topic, let's meet our team, which consists of Nilambery, Rany, Lim Zhi Qian, and Devy.
Hello, my name is Nilambery Rany. Now I will talk about introduction part. The title of this article is Public Knowledge and Attitudes Toward Liver Disease and Liver Cancer in the Brazilian Population, a cross-sectional study. The authors of this article are Paulo Lisboa Bittencourt, Liana Coates, Heloisa Ferreira-Kiza, and also Maria Lucia Gomez Perez. These authors are mostly healthcare workers in Brazil. They are experts in this field. For example, Paulo Lisboa Bittencourt worked in the unit of gastroenterology and hepatology. They released a lot of articles that are related to liver disease. The aim of this article is to investigate the public knowledge or attitude toward the prevention and screening of liver disease in Brazil population. Why is this study important? It is to know and understand the severity of liver disease in Brazil and the factors that cause it, like the lack of knowledge and less structure. Other than that, to create awareness about the severity of the cirrhosis and liver cancer. Last but not least, is to emphasize HPV vaccination and testing, HCV screening, and VH treatment among Brazilians, as the viral hepatitis is one of the common cause. Okay, now I want to talk about summary of this article. This article focuses on cirrhosis and hepatocellular carcinoma (HCC) in Brazil, emphasizing their impact on public health. Liver disease are a leading cause of mortality globally in Brazil, with over 2,000 liver transplantation annually. Main cause of cirrhosis and HCC in Brazil include viral hepatitis, which is especially hepatitis C, alcoholic liver disease, and non-alcoholic fatty liver disease. Study conducted in 2021 with over 1995 participants reveals a lack of awareness among Brazilians regarding the cause and risk factor of liver disease. Participants associate liver cancer with alcohol abuse, non-alcoholic fatty liver disease, and smoking, but viral hepatitis is less recognized. Need to improvise the education and awareness campaign highlight to address misconception and promote preventive measures like hepatitis B vaccination and screening. Disparities observed in knowledge and attitudes based on factors like education level and income, with lower hepatitis B vaccination and testing in poorer northeast and north region of Brazil. Emphasize addressing knowledge gaps to enhance prevention, screening, and early diagnosis of liver disease, especially viral hepatitis in the Brazilian population.
I am Lim Zhi Qian, and I'm going to present the methods for this study. We will start with the study population. The study population is a representative of the Brazilian population over 18 years old, of both genders, all socioeconomic strata, and educational level. How they carry out the experiments. The cross-sectional survey was conducted. It was face-to-face interview, which averagely lasted for 15 minutes. They had interviewed 1,995 respondents. They conducted the survey in a highly frequented road intersection sideways chosen randomly. The questions asked are about the socioeconomic and demographic data of the respondents, as well as the health-related data. The questions asked for health-related data are: first, the respondents' opinion on leading causes of liver cancer and cirrhosis; second, the vaccination and testing history for hepatitis B and hepatitis C, and if the respondent never performed any vaccination or testing, they will ask an extra question about the reason for not performing hepatitis B and hepatitis C testing. Third, the awareness of free hepatitis B and hepatitis C testing in public health system. And fourth, the agreement or disagreement with the statement related to non-alcoholic fatty liver disease (NAFLD) and its association with cancer, myocardial infarction or stroke, cirrhosis, and diabetes. There are selection bias in this study. The selection bias in sampling method is that the interview was conducted in the highly frequented road intersections. This method introduced a bias, as people present as this location may not fully representative of the entire population. For example, the individuals who are employed or with specific socioeconomic characteristics might be overrepresented or underrepresented. There is selection bias in survey method too. Bias might be introduced by the face-to-face interview at road intersections. It is because the individuals who are more willing to participate in such interview may be different from those who are not. This could affect the generalizability of the findings. There are limitations of the techniques too. The limitations are due to the length of interview and self-reported data. The length of interview are averagely 15 minutes, which is a little bit long and might cause fatigue among the respondents. This will affect the quality of responses toward the ends of the interview. The self-reported data, such as the information on vaccination testing and reasons for not performing tests. This might cause the social desirability bias, where the respondents provide answers that they think that are socially acceptable only. The statistical methods are divided into descriptive statistics and inferential statistics. The descriptive statistics are frequency, which likely created for categorical variables such as gender and geographic region to show the distribution of responses. The central tendency is measured in mean, median, and mode, are calculated for quantitative variables such as age and household income. The measures of dispersion for the variability in responses are analyzed by standard deviation or interquartile range, especially for the continuous variables. The inferential statistics are Z-test of proportion, chi-square test, p-values and significance level, and Bonferroni correction. This will be explained more in the result part. So, the last questions for the method. Is the method appropriate? The answer is yes. It is generally appropriate to investigate and answer the questions of the study, but it is presented with some potential biases and limitations. The potential biases and limitations should be acknowledged when interpreting the results. Adjustment and considerations should be made to enhance the validity and reliability of the study. The solutions to overcome the potential biases and limitations will be discussed more in discussion part. Now, we proceed the presentation to the results of the study.
The most significant piece of data presented by authors to answer the question is related to the awareness and behavior of Brazilian population regarding hepatitis B vaccination, testing for the hepatitis B and C, and evaluation of liver health. Specifically, the authors found that HPV vaccination, 66% of the subjects received full doses of HPV vaccination, 23% of the subjects did not receive any HPV vaccination, and the balance 11% did not know whether they got vaccinated or not. Testing for the hepatitis B and C, 48% of the subjects had been tested for the hepatitis B virus, and 47% of the subjects had not been tested for the hepatitis B virus, and the balance 5% did not know whether they got tested. And 40% of the subjects had been tested for the hepatitis C virus, and 52% subjects had not been tested, and the balance 8% did not know whether they got tested or not for the hepatitis C virus. Evaluation of liver health. About 41% of subjects had performed any evaluation to access liver health. 56% of subjects had not been performed any evaluation, and the balance 3% do not know whether they got performed any evaluation to access the liver health. From the data collected, the findings categorized into causes and risk factors for liver cancer and cirrhosis, and attitudes and awareness regarding hepatitis and liver health. In the first findings, for liver cancer causes, most participants attributed liver cancer to alcohol abuse, NAFLD, and smoking. In cirrhosis risk factors, commonly recognized risk factors included alcohol abuse, smoking, and NAFLD, and heredity. Lastly, knowledge gap. Lack of knowledge about the subject was reported by 6% of participants. In second findings, attitudes and awareness regarding hepatitis and liver health. For prevention and early diagnosis, 2/3 of subjects claimed to have received full dose of HPV vaccination. Less than half had been tested for hepatitis B, hepatitis C, or evaluated for liver health. In demographic influences, complete vaccination for hepatitis B was more common in women, those aged 25 to 44, higher education and higher income. Testing for hepatitis B was more frequent in older age groups, higher education and higher income. And lastly, testing for hepatitis C was less common in younger subjects, alcohol drinker, and lower socioeconomic classes. Awareness and testing. 77% of subjects were aware of availability of free hepatitis B and C testing. Reasons for not being tested included feeling tests were unnecessary, lack of interest or motivation, or no recommendation by a general practitioner. Attitudes towards NAFLD. Over half of the participants agree that NAFLD could lead to cirrhosis. Response varied on the causal relationship between NAFLD and the type 2 diabetes, myocardial infarction, or stroke and cancer. The margin of error across all the variables is 2.19%. The confidence interval is 95% for all the proportions. The critical value is 1.96 and the p-value is 0.025. Significance level is less than or 0.05 was considered to declare statistical significance, as the p-value is 0.025, indicating there are statistically significant differences in the proportions across various categories. The outcomes mentioned in the study are the surrogate outcomes. In the context of passage, the information revolves around the participants' perceptions behaviors, such as vaccination rates and testing for the hepatitis, and the awareness of available healthcare services which may indirectly impact the clinical outcomes.
Okay, hear me again. Now let's move on to the final part of this discussion. First of all, how the authors link the study findings with other studies. They link these findings by comparing their result with previous study with the similar topics that had conducted in series. Next is, do other studies support their findings? First, global studies reveal widespread misconception about the causes of liver disease, with a tendency to attribute them to alcohol abuse rather than recognizing the role of viral hepatitis. Education and awareness campaigns are identified as crucial in improving understanding of liver disease and promoting preventive measures globally. Socio-economic factors such as education level, income, and regional disparities play a role in influencing knowledge and attitudes toward liver health, reflecting broader trends to observe in healthcare. The implications of the studies are public health implications. The study reveals a potential gap in public awareness in Brazil regarding the significant role of viral hepatitis in liver disease, impacting the success of the country's elimination plan in terms of prevention, vaccination, testing, and treatment. Second implication is for health education. The findings underscore the need for targeted health education campaign to address misconception and increase awareness about the role of viral hepatitis in liver disease. This suggests an opportunity for the Brazilian health minister to enhance knowledge about risk factor, transmission, and consequences for more effective prevention strategies. Last but not least, overall impact. The study's implication extend beyond public health, emphasizing the importance of informed public understanding to support successful national health initiative and improve outcomes related to liver disease in Brazil. The limitation of this article is there is a lack of external validation of the survey questions. So, the way the author overcome these limitations are applying weighing by demographics to address bias and make the sample representative of the Brazilian population. Other than that, acknowledge the external validation limitation and stress the need for the future validation efforts to ensure the reliability of the survey instrument. Last but not least, can the study result apply to other populations? No. Why? It is because caution against extrapolation. Authors advise against generalizing results to other populations by such as relevance for those with similar healthcare contexts and cultural backgrounds. Next is focus on general population knowledge. The study concentrates on overall public awareness and may not directly apply to the individual patient preceptively and specific clinic context. Then, informing healthcare providers. Despite limitation, the study provides valuable insight for healthcare providers in Brazil by highlighting potential gaps in patient understanding, aiding in targeting intervention and education. That's all from me.
In conclusion, the result of the study indicates that most Brazilian population attribute paralysis and HCC to alcohol abuse and neglecting the burden of liver diseases associated with viral hepatitis, and most Brazilian population have proper attitudes toward prevention, screening, and early diagnosis of HPV and HCV. Public health education about liver diseases should be emphasized so that more Brazilians could understand the main causes of liver disease. The result and findings from this study are unable to apply to Malaysia, since Malaysian population has quite a large difference of cultural background than Brazil. So, the attitude of Malaysian toward liver diseases most likely to be different as compared to Brazilian. That's all of our video. Thank you for watching.